Okay, let's go ahead and get started. Thanks everyone for joining us for today's CFSS office hours for lead agencies. My name is Erin Haldine. I'm the CFSS policy lead here in the Disability Services Division. Thanks for joining us. So today we have a little bit more of a full schedule. We're going to give some updates regarding our CFSS information sessions, give a couple reminders regarding the service delivery plan and the addendum. We're going to talk about FMS monthly spending summaries, ending a PCA or CSG service agreement early, transitioning from CDCS to CFFS, and then we'll talk about the temporary service delivery plan approval that was announced on September 30th. And then we'll open it up to a question and answer time. So let's go ahead and get started. Just a couple meeting reminders. If you're putting something in the chat, make sure that you're not listing any specific names or the names of organizations. We want to try to keep that information confidential. If it is important for us to know that information, you can instead send us an email rather than putting it in the chat. And then if possible, only ask questions that are related to the slide that we're presenting. I'll try to pause in between each slide or each topic to allow time to answer some questions in the chat regarding that particular topic. And then at the end of the presentation, we'll kind of open it up to different topics or other types of questions if you have any. We have been doing some CFSS information sessions for people who are either assessed for CFSS or who are interested in learning more about the program. We've offered 3 of those sessions so far, and we just announced that we are going to do 10 more sessions between October 20th and November 10th. So they're all identical. Nobody needs to attend all 10, they just attend one. Again, they're for people who are interested in learning more information about CFSS, and really what we cover is really kind of that basic information about CFSS, as well as information on how to start drafting the service delivery plan if a person is interested. So they can register online. This PowerPoint presentation will be posted on the DSD archives page, and so they can click on, or you can give them access to the link to register by viewing our PowerPoint there. And you're welcome to give that out to anybody that you would like to attend. Again, it's not required of anybody to come. It's just if someone is interested in learning a little bit more about CFSS. So we're hoping that that will help people as they learn more about the program. I'm not sure if we'll continue to schedule more information sessions at this point. We're going to see how these 10 go, and if we have good attendance, what kind of questions are being asked, etc. So feel free to share that with anybody that you'd like. Okay. Next is just a couple reminders regarding the 6893P, or the Individual Service Delivery Plan, and then some reminders also on the 6893W, which will be on the next page. So the 6893P, a reminder that all sections of the P are supposed to be completed by the consultation service provider or the person before they submit it to you for approval. So the exception to that is for people who are using the agency model. For the agency model, the agency provider is going to complete the Individual Abuse Prevention Plan section, or the IAPP, as well as the Worker Training and Development Plan. Okay, so for the agency model, so that's the bullet on the screen. So the agency model, the provider agency is going to fill out that IAPP and Worker Training and Development. The provider agency can include that information directly on the service delivery plan, or they can use their own document, whatever they choose. And they are not required to resubmit the documentation to the lead agency for approval after they complete those 2 sections. So if you are getting a plan for the agency model and those 2 sections are left blank, that is okay. Okay, so we did get some feedback from people that there are other sections that are being left blank by the consultation service provider, or we've also gotten some feedback that consultation is maybe putting in incorrect contact information for providers, or kind of making up contact information for providers. So we are meeting with the consultation providers next week and are going to do a small retraining on that piece as well, so that they understand that these two sections are the only two that can be left blank on a service delivery plan, and all other sections need to be completed with the correct information. Okay, so some reminders regarding the W, or the addendum to the service delivery plan. A reminder that the 6893W needs to be completed for all service delivery plans. So that is regardless of if you're making any changes to the date or the total units that are available. The W needs to accompany all service delivery plans. So the service delivery plan will be in Min Choices, and the W, you'll also upload that W into Min Choices. And that is the document that you're using to show your approval. So you're listing the total units or dollars available, as well as the dates that the services can begin. And that's also the document that you're going to be signing. So there's not a lead agency signature on the actual plan itself. The signature is on the 6893W. Okay, so it's important that that gets completed for every plan that you're reviewing. Okay, and if you're with an MCO, the MCO can choose to use our document, the DHS 6893W, or they can choose to create their own document if that MCO has their own document with similar information. But regardless, a document needs to accompany the service delivery plan, okay, for the MCOs. Okay, so I'm going to pause and answer some questions that I'm seeing in the chat. So will the 6893P, or the service delivery plan, need to be updated with the 2026 rate changes that will go into effect? Yep. So we actually just emailed about that this week, and I'm not sure exactly when that change is going to be made, but yes, we have that on our radar, and that will change at the appropriate time. Perfect. Thank you. I'll pause for just a second more to see if there's any questions on the P or the W. Okay. FMS monthly spending summaries. We got some questions this month about if FMS providers are required to give the spending summary to the lead agency. So yes, they are required to send you a monthly spending summary. So the FMS providers have to provide a monthly report, and in that report, it should show the services that have been billed by the person, or the services that have been used, including all the costs for the FMS providers and the balances that are remaining or available to the person. Okay, so they are required to send that to the person or the representative, the case manager, care coordinator, and the consultation service provider if the person doesn't have a case manager. Okay, so when you receive those reports, ideally you would be reviewing the reports and making sure the person isn't overspending, or checking in to see if there's any issues with the person. You should be reviewing that information. That is the purpose of the reports, right? So if you want to learn more information about that, you can look at the FMS documentation and reporting page in our CFFS policy manual, which I've linked in this presentation. Don't see any questions about that. Regarding the previous slides regarding the addendum and the plan, a comment asking if we can remind consultation providers to use the newest form. Yes, we can certainly do that. I'll review that with them next week when we meet. So this requirement for monthly spending summaries would be for everybody. so state plan and waiver. But they are not sending it to the lead agency if the person doesn't have a case manager. So they're sending it to their consultation service provider. Oh, and I think it says that you're continuing to get all of the Type B monthly reports. I can review that with the FMS providers. It may just be that their system is set up to send it automatically to the lead agencies. So that just might be something they have to change in their system, but we can let them know that.
Erin?
Yep. Oh, sorry. Yes.
There's a follow-up question about the 6893P and a question about, does the person need to write a new P, or will the lead agency write a new W showing the updated rates and budget? And I don't think we're asking people to redo a new plan, because that would be signatures and everything else that would be needed. To be honest, some of the things in MMIS will just pay differently. So on a Type B for the agency model, it will just pay the new rate without having to actually build that anywhere. I think the budgets may need to have some tweaking, but I'm not certain if we think the FMS is going to do that for the new rates or no.
Thank you, Janine.
Mm-hmm.
Sorry, did you have?
Well, I think we just have to talk about it. I'm not sure. I mean, I know that we wouldn't ask everybody to do a new P for all of the rates. That would be everybody across the board. But I think we'll need to talk about how the FMSs will update the stuff on the budget side.
Okay. How about to this group, we will talk about that here at DHS, and probably consult with our FMS providers as well, and then we can get back to everybody with an answer to that.
Yep.
Thank you. There's a question that asks if case managers are allowed to sign the addendum. Yes, actually, case managers are required to sign the addendum, or the lead agency, whoever is approving that service delivery plan, would be completing and signing the addendum. Janine, can you answer this one? Are lead agencies responsible for reviewing the spending reports if there's no case manager, or is that the consultation service provider's responsibility?
No, that's really consultation if the person doesn't have a care coordinator or case manager.
Thank you. And then our monthly reports only sent for the budget model. That is all that is being sent by the FMS provider. I don't believe agency providers send a spending summary.
No, they just have a conversation with the person, and they're able to bring up any concerns they have with care coordinators or case managers about the use of service.
Okay. We wanted to talk a little bit about how to end a PCA or CSG service agreement early if needed. So as you all know, you're entering these service agreements for 6-month periods of time. So I'll just use PCA as the example, but this could apply to CSG as well. But you're entering 6 months of a PCA at a time until someone is ready to transition to CFFS, knowing that everyone has to be transitioned by September 30th of 2026, unless they're on the AC program. The deadline is March 31st of 2026. Okay. But if somebody has a 6-month authorization and they are ready to transition to CFFS before the end of that 6-month period of time, they can do that. That is the goal, right? They should be working with their consultation service provider to develop that plan and transition over to CFSS. And sometimes that won't take the full 6 months. It may, but it may not always take the full 6 months. So what we really need all lead agencies to understand, so if you can bring this back to the teams within your lead agency that are working on this, is that there needs to be some communication between the lead agency and either the FMS provider or the agency provider to determine the start date of when that person should transition from PCA to CFSS. Okay, so we cannot backdate or start services retroactively. Okay, so you'll want to ask the existing PCA provider how many units are needed for the PCA service agreement, and then discuss the date that should end and the CFSS service agreement should begin. Okay, so again, you don't want to backdate. Okay, so end the PCA service lines on the day the person's going to transition to CFSS, and then enter the person's CFS services on the lines that start on the date after the last day the person's going to use their PCA services. Okay, the reason for this is CFSS providers, and FMS providers, they have to do all of their initial or like intake paperwork, right? They have to train the workers. They have to make sure they pass the background study. They have to make sure that the person has all of their like service initiation pieces complete. So it's not just an automatic transition from PCA to CFSS or the consumer support grant to CFSS. Okay, there are pieces that the provider needs to do in advance so the person is ready to begin on the date that CFSS starts. Okay, even if the person has been with that particular provider for a number of years, CFSS is considered a new service. And so they need to do all that at service initiation and the retraining of the workers again, because this is a new service. So the person just doesn't automatically transition over to CFSS. So we are hearing from a lot of our PCA providers in particular that they're getting service agreements that have been backdated and they don't have everything ready for that person to transition to CFSS because they didn't know that it was going to occur on that date, right? So you'll need to have a discussion with the provider in advance to say, hey, when are you going to be ready? Or what is a good date in the future to have that person transition over if they're going to transition before the end of their 6-month service agreement. Okay. So that would not be the consultation service provider's role because consultation is developing the plan. And then you're going in and you're reviewing the plan for approval and you're determining the start date, right? Based on the conversation that you're having with those providers. And then that's the date and the dollars or units that you're writing on that 6893W or the addendum to go with the plan. Okay, so I'm going to pause there and look at what's in the chat. So there's a question, if you're getting the service delivery plan prior to the end of the 6 months, instead of doing the extra work, can you wait to authorize CFSS once the current 6-month PCA authorization ends? I mean, I think that probably would depend on a lot of different things, like how far away is it, right? Did they complete the plan and there's still 5 months of PCA left, or is it just a couple weeks? You're probably gonna have to make that determination on your own, but there are some benefits of CFSS that the people may want access to, such as purchasing goods and services, worker training and development, and the other, different workers being allowed under CFSS. So there might be reasons that the person may want to transition when they're ready. Janine, do you have anything you want to add to that?
Yeah, I mean, I think the discussion that you just had before this one about really talking to providers and making sure they're ready to go is another conversation that you would have to have when you're talking about a start date.
Thank you.
We are encouraging people to go to CFSS as soon as they can do so. And as soon as it makes sense for the providers, being ready to go and all of those things.
Okay, next we wanted to talk about when people are transitioning from CDCS to CFSS. So there's a couple of different scenarios that I'll review over the next few slides, and then I'll pause for questions or look in the chat for questions when we're done. So the first scenario is when somebody is no longer eligible for the waiver. Okay, and then they're going to transition from CDCS to CFSS. So again, it's really important to kind of have that transition planning, making that a priority. And you'll want to do that as soon as you know the assessment results, right? So if a person is found ineligible to continue with their waiver services, all of the waiver services are going to end, and that includes CDCS. Okay, so you'll want to immediately begin the CFSS planning so the person doesn't have a gap in service. Okay, so you want to begin consultation services as soon as waiver ineligibility is determined. You're going to authorize CFSS consultation services while the person is on the waiver. And that will allow the person time for the provider or the consultation provider to develop and approve the service delivery plan before their waiver span ends. Okay, so the person needs to select their consultation service provider, and then you're going to be ending a line or adding a line for consultation to the service agreement. Okay, and it's important to know or remember that all CFSS related costs, so that includes the cost of the consultation service provider, are a part of the CDCS plan or the CDCS budget. So when you're adding that to the service agreement, you'll likely have to reduce another part of the CDCS budget because that is going to be coming out of their CDCS budget as they're working with a consultation service provider. Okay. And then another piece to remember is just if there is an appeal, if the person appeals the waiver ineligibility and elects to continue services, CDCS may continue during the appeal period under the continuation of benefits provisions. Okay, so the next scenario that we want to go through is if a person is using CDCS and they remain eligible for the waiver, but they're choosing to transition off of the waiver and use CFSS. Okay, so this is the scenario where if someone continues to be eligible and they're choosing to transition, they can really transition at any time, okay, because they're still eligible for the waiver. So they can continue with those waiver services temporarily while they prepare to transition to CFSS, including developing that service delivery plan. Okay, so in this scenario, the person should select a consultation service provider. You'll add the consultation services line to the service agreement alongside the CDCS services. And again, same reminder as before, that all of those costs, including consultation, are part of the CDCS budget. And then once the service delivery plan is written and approved, then the person can exit CDCS and begin CFSS. Okay, so for this scenario, remember that this was if someone remains eligible for the waiver. Okay, and then the last scenario is for somebody who's using CDCS, remains eligible for the waiver, and wishes to add CFSS while they continue using CDCS. Okay, so they want to use both services. Okay, so when this scenario happens, the person, again, they're going to add consultation services to their current CDCS plan. And then you're going to add a line for consultation services to the person's service agreement. And same reminder as before that the costs for consultation services are going to come out of the CDCS plan as well as anything else related to CFSS. And then just remember that if somebody selects the budget model for CFSS, they have to use the same FMS provider for both CFSS and CDCS if they're going to be using both services. Okay, so we kind of went through the 3 different scenarios here. So I'm going to pause and look in the chat to see what kind of questions have come through. Okay, so I'm going to answer first the questions that are related to this particular topic, and I'm going to hold off on other topics for now. But so the question is, how are the consultation lines added to the CDCS budget within the CDCS plan? So they have to come out of the total allocation that's available for CDCS. So it's not a line that's added into the CDCS plan, like the FMS provider isn't paying for consultation services, but it needs to come out of that total available dollar amount for CDCS. So CDCS includes the cost of all CFFS services, including a consultation service provider. So there's a question that says, what if they're screened and they don't have enough money in their CDCS budget for CFSS consultation services? Typically, we have 60 days of the CDCS budget left when we're screening them. So hopefully, I know this may not always be true, but hopefully if someone has 60 days left of CDCS, they have more than $600 available. So that would be the $600 cost is for 6 sessions of consultation services. If they have less than $600, I don't know, Janine, how would you answer that question?
Sorry, say that again.
That's okay. If somebody doesn't have enough money left in their CDCS budget to pay for consultation, what should they do?
That's tricky. I don't know if we really have an answer for that. Is that in a situation where they're doing an assessment and they're finding them not eligible for waiver? Is that the scenario?
Yeah,
probably?
I think so. Yep. And so they're saying typically they have 60 days left in the CDCS budget. So my thought is hopefully if someone has 2 months left or 60 days left of their CDCS budget, they would have at least $600 left to pay for consultation to develop that plan. They may not. It's possible a consultation service provider could develop the plan with less sessions. Maybe it doesn't take them a full 6 sessions to develop that plan and get it approved.
Yeah.
I guess I don't know. I see a question about, the question is, what about worker training and development once approved? Are you asking if worker training and development is a part of the CDCS budget? If that is your question, yes. So any CFSS cost, or wait, yes, when using CDCS, all costs of CFSS come out of the CDCS budget. Okay, so here on the screen, all CFSS related costs, including consultation services or any, worker training and development for this question, are considered to be part of the CDCS plan and budget. There was a question regarding the previous slides on the approval date. So I'm just going to go back. See if I can find it quick. This one, if someone is ending the service agreement early, and we had said to not backdate and that you need to work with the existing providers to determine what date the person should transition over. So there's a question in the chat that's asking, is it based on the start date of when the FMS tells us? So only if the person is ending their service agreement early. So they're transitioning from PCA or CSG over to CFFS early. Then you'll need to talk to the providers or work with the providers to determine what date the person should transition. Okay, so for example, if you receive a plan today on October 16th, and you would want to call the FMS provider or the agency provider and say, we have an approved plan for somebody. They're ready to transition over to CFFS. Can you transition them today? Or what would be, can you get them enrolled and ready to go by November 1st, or work with them to determine when they can transition over? Again, that's only if they're transitioning early. Okay, so from a provider standpoint, they have a service agreement in place for PCA or CSG. Let's just hypothetically say through the end of the calendar year, so through December 31st. So if someone has their plan approved or developed and ready to go as of today, talk with them and see, would November 1st be a better start date? December 1st, like when can you get that person enrolled within your organization, within your agency, right? They have to do all that service initiation with the person and all the workers before they can transition to CFFS. So likely they wouldn't be able to start that person today. Maybe they could by November 1st, right? A few weeks out. Maybe they could work with the person to get all the paperwork completed and do all the intake meetings, etc. So they're ready to go. Okay.
Erin?
Yeah.
I just want to back up just for a second with the question about screening them and if they don't have enough money in their CDCS budget at the end of the year and looking at using consultation services and personal care, the service of personal care under CDCS. And just, I know there's not a perfect solution, but, something that enters my mind is the fact that part of self-direction is being planful, right? So if you have an idea that you wanting to continue to use CDCS, which is I think what that slide was, and also use the service of CFFS under CDCS, that is a possibility. But that individual is choosing to self-direct both of those services, and so they're going to have to be planful, I think, about thinking about authorizing consultation. On the other note, if they are still using CDCS, I know it gets a little complicated, but I'm not entirely sure, it would be interesting to have some scenarios, why people are choosing to use CFFS under CDCS. And I'm sure a lot of it is about, some things with hiring and that sort of thing. But the other thing I think that they would have the potential to do is, could they still continue using CDCS to pay that staff until they're ready to transition? So, that new plan starts. They certainly can pay that worker using CDCS, right? And I'm sorry, I'm not remembering what it's called, the actual service, if it's personal care or paid personal, whatever it is under CDCS, and then transition, right? So there might be ways that you have to be creative and tricky to get around that. Just a couple of thoughts, and hopefully that makes sense to people.
Thanks, Meredith. Okay, the last topic I wanted to talk about was the new temporary approval, or the service delivery plan approval. So hopefully everybody saw the e-list that went out on September 30th with this new process. So we knew people were coming up to 1 year of being assessed for CFFS and that there were people who had not yet transitioned over. Okay, and we didn't want anybody to have a gap in services. So we determined that we were going to put this temporary service delivery plan approval process in place. Okay, and so what this process is if a person's using CFFS at the time of their reassessment, and they will not have an approved service delivery plan before the end of their plan year, the lead agency can provide temporary approval to avoid a gap in service. So what the lead agency needs to do is they're going to authorize the same services as the previous year. Okay, and what that means is that it's not the exact dollar amount or the exact units. What it is the same services. So if somebody is using personal care, if someone's using goods, if someone's using PERS, okay, those are the services that can be authorized because they were authorized the previous year. Okay, and then you'll want to authorize those services within the limits of the eligibility of the reassessment. Okay, so if someone has a new, a higher or lower, I guess, amount of units available, those services have to fit within that amount. Okay, and then you're going to complete the 6893L, which I'm going to show you in just a minute. Okay, so like I said, this is really for lead agencies to do when they have an on-time assessment. Okay, so the person does have to have that assessment in place and be reassessed for CFFS. Okay, they need to, or they can only use the same services as they were receiving the previous year. So again, personal care, PERS, goods and services. The person cannot make any changes to their services until they've developed that new service delivery plan. Okay, and then you just need to stay within the new newly assessed amount. Okay, so again, the lead agencies need to complete the 6893L, and I'll show you what that looks like here. Give me just a minute. Okay, so it is a pretty simple form. So it's just a temporary CFFS individual service delivery plan approval. It says on the top, your lead agency determined you could continue using the services on your previously approved CFFS individual service delivery plan until the lead agency approves your new plan. Okay, so it's just the person's identifying information on the top, then the total units or dollars that you're approving and the start date. And then there's an open box here where you can list the services that are approved. And again, they're the services that were approved the previous year. So you'd write personal care, goods, or whatever those particular goods are, PERS, etc. Okay. And then you're going to sign and date the bottom of the form. Okay, so again, this is for somebody who's been reassessed. They've had their on-time assessment, and they don't have an approved plan in place yet because maybe they can't get in to meet with their consultation service provider to develop that plan. Okay, so once you've completed the 6893L, you're going to upload it into MinChoices. You're going to send a copy to the person and their providers. Okay, so that's how the FMS provider or the agency provider are going to know that they can continue services. Of course, they'll receive a service agreement as well, but they need that documentation so they know what services are approved. And then you're also going to use the temporary authorization and completion of the MinChoices support plan.
So Erin, there are a couple of questions in chat. There's a question about the assessment must be complete to do the temporary service delivery plan. And if that's a question about min choices, we can't answer that. That would have to go to your mentor.
Yeah, I see some questions regarding the dates, so I'll maybe just go through the slide first. That might answer some question. So the temporary approval date, so the lead agencies are going to enter service authorization for 1 year. Okay, and then within that 1 year time frame, the person needs to work with their consultation service provider to develop that service delivery plan or the 6893P. And then you as a lead agency needs to complete the 6893W. So that needs to be completed before the end of the year. Okay. And I think I saw a question that says, what's the motivation for somebody to complete the 68 the service delivery plan? Well, one, they can't make any changes to their plan, so they can't add a good, or they can't switch models, or they can't change anything that was previously approved until they have a new service delivery plan. Okay, so that's one motivation. Also, that's really a requirement of the program, is they have to have a plan that's in place. This was just because we're at a point where people were not able to get into with their consultation service delivery provider to develop that plan. And so we're hoping that by allowing this temporary approval, that they can at least continue with CFFS without a gap. And then they need to work with their provider to develop that plan. So I see a question that says, for the temporary approval or the 6893L, if you have that 6893L in place and receive the service delivery plan, a couple months later, do they need to complete the 6893W? Yes, you do. A W is required for every plan that you approve. So that so think of it this way: the L, or that temporary approval, you're really approving the services that were approved last year. You're just telling the person they can continue with the services that they received last year, just at the new amount. But when you approve the new plan, those might be new services that you're approving, right? So they've developed a new plan. So you need to approve that new plan and have that addendum, or the W, to accompany that new plan to show your approval. And again, the W is the only form that has your signature on it to approve that new plan. So the W has to be completed to accompany the 6893P, or that new service delivery plan. I see a question that says, should the temporary approval be used by request only, or how are we identifying who will need these? I think you're going to have to work with a person to determine if they have an approved plan. So that's something that you're going to have to kind of determine on your own, who within your caseload or within your agency, within your lead agency, needs you to do the temporary approval versus who has a plan in place that you can approve.
And Erin, I think this is something for lead agencies to decide. You certainly could get a call from a person or something else, saying that this isn't going to be done by the end of the current service agreement for the new one. But this is something that lead agencies can make decisions on and begin the process.
Thank you. There's a question asking, are there temporary service options for a person who is new to CFFS and they maybe have a provider chosen, but they're waiting on that plan to be developed? So no, this temporary approval is for people who are currently receiving CFFS and have been reassessed for CFFS. And the temporary approval is really for them to use their plan from last year. That's what's being approved. So there is not a temporary option for people who are new to CFFS. So there's a question that says if a good or service was only a one-time purchase, like a handrail, for an example, we wouldn't need to authorize that again. I think that would be up to you to determine if it's a service that needs to continue or if it was a one-time purchase and should not continue on the new authorization. Pardon me for the silence. I'm just trying to read through the chat.
So Erin, there's a question about if someone is not eligible for waiver and moving to CFFS, do we put a type B service agreement in when the person is no longer eligible for waiver? So yes, if the person is moving to CFFS, a service agreement will have to go into MMIS to authorize those services.
So there's a question that says if the assessment results is a reduction of hours, are they approving the previous year's higher amount? No, you would be entering it at the reduced amount. So the personal care line or the services need to fit within the new eligibility.
Erin,
Yeah.
except for our notice of action and continuation of benefits process. So if the person is appealing and wants to continue benefits at the old level, then you would be authorizing on one line, the level that they are eligible for, and on a second line, the continuation of benefits, the notice of action and the continuation of benefits lines.
Thank you.
Mm-hmm.
Okay, so does approving the new plan after the temporary approval been given result in a new service agreement? So it might result in a revised service agreement. You're not going to end one and start a new, but you would likely need to revise the service agreement that's being entered or that's been entered. Okay, so there's a question that says, can you confirm that the new assessment results for personal care can be used for the 6893L and only the goods and services can't be changed until the new service delivery plan? So what you're approving is last year's services. So if they had specific goods that were approved, or they had PERS that were approved, or maybe classes that the workers were attending or something like that. Those are the lines that can be approved on the new temporary approval. So the 6893L. Okay. And some of those are, you may be able to add units or if the person based on their new assessment results. Okay, but nothing else can be changed. So they can't add different services or take away services, I suppose, but they can't be adding different services, maybe approving new goods or switching models or other types of changes that may occur. Okay, so there's a question here that I just want to make sure that maybe I'm just going to re-explain the process here. So if you're approving the temporary approval is only for people who currently have CFFS. There isn't a temporary approval for somebody who's using PCA and has not yet transitioned over to CFFS. Okay, so if you recall, everybody needs to transition. I'm combining kind of two different topics to answer this. There's a question in the chat regarding this. So I think someone is confusing the two different topics together. So everyone needs to transition from PCA to CFSS by September 30th of 2026. Okay, with the exception of alternative care. They have a different date. But okay, so the majority of the people need to transition from PCA or CSG to CFSS on September 30th. Okay, so you may be entering, 6 more months of PCA services or CSG while the person works with their consultation service provider to develop their new plan and transition over to CFSS. For those people who have already made that transition to CFSS, so they're using CFSS today and they've had another assessment and they're again assessed for CFSS, and they can't get with their consultation service provider to develop another plan or their new plan, you can authorize a temporary approval using their current plan and completing the 6893W. So there's no worry for those individuals to make that September 30th deadline because they've already transitioned to CFSS. Okay, if you have any more questions on that, let me know. There's a question that says, what's the code for temporary CFSS? There is not a separate code. You're just entering the same. So it's like the T1019 line for personal care, the same for all the different services. So there isn't anything on the service agreement that shows that it's just temporary approval. Okay, the service agreement is going to look the exact same. Okay, I'm not seeing any more questions regarding this topic. So feel free to put any other questions in the chat. It can be regarding one of the topics we discussed today, or if you have some questions on a different topic, feel free to ask. Oh, it looks like someone wrote in the chat that their hand is up. Sorry, Nathan, I can't see whose hands are up. Is anyone able to unmute Nathan Dahl?
Yep, you're unmuted, Nathan.
Okay, great. Thanks. This is just my question about the temporary authorization. These are just some concerns that were brought up and just want to voice them. I think we've all reviewed hundreds of plans at this point, and the majority of them, I would say over 90%, are staffing only without goods or services or personal emergency response system, which looks a lot like PCA before. And my concern is by providing 12 months of temporary authorization, there won't be much motivation for the person to complete their service delivery plan. And it sounds like it's our responsibility now as a lead agency to ensure that those plans are completed on a yearly basis after we enter those temporary authorizations. I'm concerned about the ability to have the capacity to do that, to follow up on that and review all the plans. Just a couple thoughts on addressing that is, could it be possible to have it be a 6-month approval versus the full 12-month, which would push the issue to have that service delivery plan completed? And the other thing is, if there is an increase or decrease of assessed hours or units, that typically means there's a new dependency or a dependency has been removed from the previous year. So the current plan they're using wouldn't align with the temporary authorization. So I'm just concerned, I feel like a lot of people are not going to finish those plans, and it's going to come at the end of their span year of trying to get those completed. So those are just some of the concerns and things that have been brought up in our county meetings,
Sure.
and just thinking about how we can address this ahead of time. And I like the idea that we put in the temporary authorization because we don't want people to have gaps in services. We
Right.
had to do something, but
Mhm.
I'm just concerned about the the motivation to finish it, because typically the motivation is to have their providers and their staff paid, which we're giving them now.
Yeah,
So Erin, can I
Yeah.
say a couple of things?
yeah. Go for it.
So we considered the length of this temporary authorization and talked with our EVV folks. And because of EVV, there are, and some of the stuff that FMSs have learned about EVV in CDCS, we really, when we talked it through, we were concerned about lead agencies having to go in after 3 months or going in after 6 months or whatever it might be. And when service agreements aren't updated timely, then they can't be entered into the EVV system that the provider is using. And then they're not able to send through some of their billing. So it becomes a big, very big hassle for providers that need to do things in EVV when we don't have an ongoing service agreement. We did talk about like the $10,000 that are going over to FMSs for CDCS to avoid a gap in service. So we've talked to a number of people, and that's how we came to the year. Now, if people don't have a full service delivery plan approved by the end of the year, they're not going to be able to do that again. I mean, this is trying to get people through. And if they don't have a permanent one by the end of their service agreement, they will not be able to do this again. We can't have a temporary on top of a temporary. It really needs to be the actual fully formed service delivery plan. And I think the risk that providers have in not having a fully formed service delivery plan is that there could be actions taken by OIG, because we're saying that this is temporary so people don't lose services, but it is not ever meant to be the service delivery plan that's good for the whole year. So that is, I'm certain we will have quality assurance kind of discussions about that, because that will be important. And people don't want to have takebacks because they don't have the official plan before the end of that service eligibility year.
That does make sense. Appreciate it, Jean. On the temporary on top of temporary, that does make sense.
Yep.
I can see it a year from now. You know, a lot of people I think are going to not have that completed. And the reason why I say that is because people already are not finding their consultation providers after numerous, prompts and things like that, and checkpoints along the road with semi-annual meetings and 6-month agreements and such, and, reason codes of 517 on service agreements. We're still seeing that with a lot of clients. So I just want to voice that. I totally understand the EVV part. It does feel like a lot of back to the lead agency to track all that again, but we'll work with what we got. I mean, we gotta, this rollout is kind of bumpy, but we'll just kind of work with what we got. And I mean, the ultimate goal is to make sure that people have the services in place, and can be supported in the community. And that's what the top auth is doing. Yeah.
Yep. Yeah, I don't know if this will continue for years, if it'll be really a permanent piece or not. But at this point, just trying to get people to not lose service was really what we were trying to figure out, and to get information to lead agencies, before we actually were in a situation where people were having services cut off. So we tried to do this as quickly as possible, just as a stopgap. Unlike some of the other decisions that we've had to wait for people above us to make for a very long time, we tried to get this going as soon as possible. So it's pretty bare bones, but I think we'll be talking a little bit more about some of the process throughout this year. We just didn't want people to fall off services. So, but thank you. Thank you for your concerns. We appreciate it.
Yeah, totally. And I get it. I mean, we're working with what we got, and you know,
Yeah, yeah.
this is essentially a Band-Aid to fix it for now. And
Yep.
as we smooth out this process, as we get into year 2 of this program now, and
Mm-hmm.
I totally get it. I just want
Yep.
you to
Yep.
hear what we're talking about between lead agencies and in our county, specifically in Washington County, and um, just so you have that when you have your discussions with your
Mm-hmm.
leadership teams. Yeah,
Mm-hmm.
thank you.
Yep. Thank you.
Appreciate you hearing me out.
Yep. Absolutely.
Thank you. I'm looking at the chat. I think that we've answered either all the questions, we've answered them either directly to the person within the chat or just through the conversations, especially with what Janine just provided. I know it was asked a couple times, what do we do if they get to the end of the year and don't have a plan? So Janine just answered that verbally. So hopefully that helped everybody. One thing I'll just add to what Janine was just saying, because I know we're over right now, over our time, is that we are, if you've attended all our previous office hours, you probably know that we are currently reviewing all the proposals for new consultation service providers. So, you know, part of our backlog with people being able to develop plans and get those approved is that there isn't capacity at consultation service providers right now. So we're hoping that as we enroll new consultation service providers, people can develop those plans and get them over to you more quickly or faster, and so that we don't end up at the end of next year in the same situation where someone can't develop their plan. So hopefully that will help. I'll answer one more quick question, and then I think I'll just buzz through the last couple slides and let everybody go since we're over. But there's one last question, says, how would we recommend we address issues with consultation service providers not returning calls or emails regarding the status of a service delivery plan? That is a good question. We know that consultation service providers are very busy right now. They have a big backlog of work that they're trying to complete. And so I think our only suggestion is to just continue to try to reach them. A phone call, an email, you can look at their contact information, kind of that generic contact information that's on their website, or if you know a direct staff within their organization, contacting the person directly. Yeah, I think that's probably, you know, the only thing you can really do. And then we meet with consultation service providers next week, so we can give them a reminder too that they need to be making sure that they return calls, you know, within a timely manner. Okay, real quick, we've got our next office hours on November 20th and December 18th. And then we have just our same resources that have been available previously, as well as our training. So in the meantime, if you have any questions, you can feel free to email us at dhs.cffss@state.mn.us. So thanks everybody for joining today. I know we're a little bit over, so trying to rush to the end here, but thanks for your good questions, and we'll see you again in November. Have a good one.
Thanks, everyone.